All right, so now we're going to start talking about more specific precautions. Depending on age and when you first went to nursing school, you may have heard universal precautions, you may have heard standard precautions, you may now be hearing about tier 1 and tier 2 precautions. So I want to try to clarify those a little bit. Currently, tier 1 precautions is the new term. It means standard precautions. And when I was in school, it was universal precautions. So you may see standard or universal or tier 1, they all mean the same thing. So standard precautions, hand hygiene with soap and water or alcohol-based product between patients. So when you enter a room, when you leave a room. Alcohol-based products are preferred if there's no visible soiling. If spores are suspected, you have to use soap and water. Non-antimicrobial soap is preferred. The antibacterial soap is not necessary, and it can contribute to resistant bacteria. Soap and water should be used if hands are visibly contaminated. You should use gloves to touch any fluids, open skin, or potentially contaminated items. General rule in layman's terms is don't touch anything wet that comes out of another person. So gloves to touch any fluids, open skin, or potentially contaminated items, remove gloves, and perform hand hygiene between patients. If spraying or splashing is possible, you would use mask and eye protection, and a gown as needed, depending on what might get sprayed or splashed. Hand hygiene must be performed after removing those things, after removing the gown, before you handle the face and eye protection. A moisture resistant bag is used for any soiled item. So the bag, it needs to be a plastic bag or a bag that doesn't allow moisture to leak out. Contaminated laundry needs to be bagged, needs to be handled to avoid leaking or contamination of skin or clothing. Sharps, make sure you use the safety device. Don't cap your sharps. Dispose of sharps directly in the sharps container immediately after use. There should be a sharps container available for use in the room. Private rooms are necessary for standard precautions only if the client cannot maintain appropriate hygiene. So that's standard universal precautions, tier 1. Basically, don't touch anything wet that comes out of another person. Tier 2 precautions are transmission-based. So transmission-based precautions are when we know that a client or suspect that a client has a specific disease that we know the mode of transmission. So we're going to start with airborne. Airborne precautions are for particles smaller than 5 micrograms. Some examples are TB, varicella, measles. COVID is now believed to be airborne, but also potentially contact and droplet. So we're going to use full precautions on COVID. A person on airborne precautions needs a private room. Providers and visitors should wear a mask. If it's TB, an N95 or HEPA respirator should be used. They should be in a room with negative pressure airflow with at least 6 to 12 changes per hour, and full face protection should be used if splashing or spraying is possible. So that's airborne. Okay. Droplet precautions are for particles larger than 5 micrograms in respiratory droplets. There's a lot of these. Most respiratory illnesses are going to fall under droplets. So strep, H flu, scarlet fever, rubella, pertussis, mumps, mycoplasma pneumoniae, meningococcal, pneumonic plague. There's a whole list. If it's respiratory, probably think droplets. A patient on droplet precautions needs to be in a private room or have a roommate with the same infection, but they need to have their own individual equipment. Masks are used for providers and visitors. So everyone that goes in should have a mask on. Contact precautions, and there are some things that are both contact and droplet. RSV is considered both, for example. Contact precautions, think things like RSV, a lot of GI diseases are contact. A lot of GI infections, a lot of skin infections are contact. So anyone who has diarrhea, if any kind of infection is suspected, they need to be on contact precautions. So think RSV, Shigella, wound infections, herpes simplex, scabies, multi-drug resistant organisms. Anybody with MRSA, doesn't matter where it is, needs to be on contact. They need to be in a private room or have a roommate with the same infection. They must have their own individual equipment. Gloves and gowns are used for providers and visitors. Infectious materials need to be placed in a single non-porous bag without touching the outside of the bag. Frequently, those things are bagged in the room, and then someone is holding a bag and they're bagged again between the room to be able, outside the room to be able to carry them to appropriate disposal. Protective isolation is in order to protect the immunocompromised client. So this is not to keep from taking something out, it's to keep from taking something in. This person should be in a private room. They need to be in a positive airflow room with 12 or more exchanges per hour. They need to have filtered air coming in, HEPA filter for air coming in. When the client is out of the room, they need to have a mask. When providers are entering the room, we need to wear masks, gloves, goggles, cover hair, because we don't want to take anything into that patient. Shoe covers. Transporting a client who is on precautions. If a client on precautions needs to be transported, we need to make sure that we're not spreading disease as we go. So Airborne and Droplet, they need to wear a surgical mask. Even though we wear an N95 mask in a room with a patient with TB, that's to keep it coming into us. The patient wears a surgical mask because that keeps the secretions in with them. Okay, so they only need a surgical mask. If any wounds are draining, cover them. And obviously we would want to make sure that we're not, if they have an enteric infection, we want to make sure we're not spreading germs that way either. Contaminated equipment. If once equipment has been used, it needs to be cleaned appropriately. Gloves and protective eyewear should be used when cleaning equipment. Most things should be rinsed first in cold water and washed in warm water with soap. Brushes should be used for hard to reach areas. Things need to be rinsed in warm water and then dried. Equipment's usually considered clean at that point. A clean sink and clean equipment should be used for cleaning. Follow facility policy for disinfection or sterilization. For things that cannot be submerged, there are different types of cleaning wipes. Those disinfectant wipes have different materials, and we need to make sure we're using the appropriate ones. Make sure that it's safe for the equipment, but also make sure that it will kill the bug we're looking for. In particular with C. diff, we need to use bleach wipes, not purple wipes. After cleaning equipment, remove gloves and perform hand hygiene. So that is transmission-based and standard precautions. We're going to come back in the next video and switch gears and talk about falls.